I3 model looks like this. We've got incomplete mechanics. Incidence and injury. So we got these three categories, and this is the breakdown. Incomplete mechanics includes limited mobility in any joint that restricts our ability to move normally. Incomplete mechanics also includes motor control dysfunction, which means you might have the mobility there, but you're still not moving well. Maybe you need a coaching cue, maybe you need a physical cue, maybe you need a scale to learn how to move correctly and then progress from there. And so this is talking about specifically mobility, decreased mobility, and decreased motor control. In some cases, this could include congenital dysfunctions where bones are formed incorrectly and normal mobility and motor control are not even an option. But for the sake of most athletes, incomplete mechanics, we're dealing specifically with mobility dysfunction, motor control dysfunction. The other category, we're really dealing with pain. And then injury speaks for itself. This is something where in the incidence category, you can still train here. So most people are still going to train with some level of pain. Either pain before that goes away once they get active, pain during, there's some active process while they're moving that hurts, or maybe they feel fine while they move, but then afterwards they're really paying for it. But this is not enough to completely shut somebody down. This is the athlete that's got the nagging knee pain and they push through. This is not changing the way somebody washes, dresses, gets on and off the toilet, and lives their daily life. Yeah, on the other hand, injury is where we're now have had some type of catastrophic event. Maybe a blown ACL, a kneecap dislocation, and here we have pain plus total change in lifestyle. We can no longer do things as we once did because we're immobilized, we've had surgery, we've got post-surgical restrictions, we've got swelling that limits normal motion and use, weight bearing is a problem. So these are our three categories. When we look at this idea of pain being a lagging indicator and a symptom of a larger problem, and the idea that pain shows up elsewhere from where the problem is, now we can really start to understand how incomplete mechanics drive pain. When we have limited mobility, we gave the example of the hips earlier. So let's say in a squatting position, a deep squat, if you have limited hip mobility, it's going to drag your lumbar spine into flexion. Over time, that flexion becomes painful, and if left unchecked, that flexion becomes a disc herniation, a nerve root impingement, and if necessary, a spine surgery, which completely changes the way you live your life. And so ideally, when we see people anywhere in this model, the idea is to shift them over one column. When we get somebody out of pain, that doesn't mean we've solved their incomplete mechanics. And when we take somebody out of this injury state, this is the rehab model, all right? This person is in rehab. They're seeing a specialist to solve some of their problems. And this is classically where clinicians fail, is that this person has pain consistently and cannot function normally, and they take this person to where they have a decreased level of pain, they can now function normally and start resuming activity, and then what it looks like to discharge from rehab is now this pain is gone. But all we've done is shift them back into this category of incomplete mechanics. And so what that looks like is we've solved all of the problems here in the symptom category. we've gotten rid of the lagging indicator from our problem, and we have solved the effect of the problem. But what is still the big elephant in the room is the cause, right? So all we've done is take this patient back to square one, or this athlete back to square one. They no longer have pain, but they still have incomplete mobility and incomplete mechanics. The only way we truly solve the problem of pain permanently and consistently is to normalize mobility. So we're going to call this normal, and we're going to say normal motor control. And what does normal mean? Normal means having a target and you consistently pursue the target. Nobody's going to have perfect mobility all the time. Nobody's going to have perfect motor control all the time. If you do, you're probably not training at a stimulus high enough to challenge you enough to create a change. And that's what the idea is behind training is we're trying to create a stimulus that challenges our mobility and motor control so that we get better as athletes. As long as we are only moving people over one column at a time and never completely addressing mobility restrictions and motor control restrictions, and teaching people how to move best inside of their mobility restrictions while we work on better mobility, then pain is always going to be a chronic problem. It may not be chronic every day, but it's going to be chronically recurrent. And that's why you see in America, chronic pain takes the cake and leads, we're the leading country in disability. Low back pain is the leading cause of work-related disability in America. Which I think is odd because 90% of low back pain patients don't need surgery. Only 5 to 10% actually need some type of surgery. And so what does that tell me? We're leaving a lot of mobility restrictions and motor control limitations on the table for some of these chronic pain patients. And when we talk about athletes with pain, we've got to be resolving completely mobility restrictions, movement control problems, if we're going to limit pain, if we're going to decrease injury risk and have a higher performance with less chance of injury kind of across the board. So we got to break out of this mindset that pain is a problem. Pain is not the problem. Our mobility is a problem. Our movement control is a problem. If we have pain with movement, we have a problem with the way we move. And that can be traced back in every musculoskeletal injury there is that's not trauma, some type of blunt force to the body. So let's break away from this idea that when pain starts, that's when the problem started. Pain shows up dead last, all right? Pain is not the problem. It is a symptom of the actual problem. And we need to go find what is the actual cause of that problem. And we need to view this through the lens of this incomplete mechanics model where if we have injury, we need to get this person back to an incidence level. If we have incidence level athlete, we need to move them back to a level where they are pain-free. And then we need to take this person who has incomplete mechanics and push them over here to normal control and normal mobility so they can have normal movement mechanics. All right? Think about it. It's a little different. It's a lot to think about. But appreciate you listening in. Catch you next time.